We have had 2 cases where persons passed away, but they have had both doses. They have had severe comorbidities in both cases. They've had more than one illnesses. So the prognosis outside of the vaccinated, the prognosis would have been bad to begin with, right? And it's not, you can't just say, well, it's the vaccine or anything of the sort. It's just the condition the persons had. They were extremely sick. Their prognosis would have been bad from the outlook.
That was Minister of Health Dr. Frank Anthony. He was responding to questions from members of the media on Wednesday during a press conference held at the National Infectious Diseases Hospital at Lilliendale, Georgetown. For the first time, the health minister announced that fully vaccinated patients had died from COVID-19. After that press conference, the newsroom was reliably informed that these patients were both men. They were aged 73 and 81 years old. The other underlying conditions they had are known as comorbidities, which, according to the World Health Organization, places individuals at an increased risk of experiencing the more severe symptoms of COVID-19. In addition to diabetes and hypertension, the 73-year-old man had acute respiratory distress syndrome. According to the Mayo Clinic in the United States, the main symptom of this is severe shortness of breath, and this syndrome typically occurs in people who are already critically ill. The man was admitted to the COVID-19 intensive care unit ICU at the Lilliendale Hospital on August 4th. He passed away on August 12th. Meanwhile, the newsroom understands that the 81-year-old man was admitted to the COVID-19 ICU on August 24 with slurred speech, and he was in a severely weakened state. He passed away on August 25. Both of these men were receiving intensive care, requiring aid to breathe through the hospital's ventilators. They had low oxygen saturation levels, which means that their bodies were not readily taking much needed oxygen to the various parts of the bodies. This means that though they were vaccinated, the men had other life-threatening diseases that contributed to their death. Reporting for the newsroom, I am Vishani Raghuveer.